Okay, you are welcome to Science Made Easy by Mukhtar. So in this video, we are going to look at Introduction to Radiography. Don't forget to subscribe, follow, and join my YouTube community for more videos. Now, Introduction to Radiography. What is radiography? Radiography is a medical imaging technique that uses X-rays to view the inside of the body. So actually, when we are talking about radiography, ladies and gentlemen, it's actually when you use an X-ray to view inside of the body. It's what we call radiography. And of course, because this techniques is used in viewing the inside of the body, that is why it's considered as the most common method of the most commonly used diagnostic tools in healthcare. Because of course, if you can use X-ray to see exactly what is inside the body, then of course we can use it for diagnostic for diagnosis of the disease. So that is why actually, ladies and gentlemen, you need to understand that because of the importance of the X-rays in viewing the inside of the body, that is why in most of the in most of the diagnostic center, you can see that there is this imaging. So that is why it is one of the most common methods of diagnosing diseases in healthcare now. And very importantly, the primary goal of radiography is to detect and diagnose diseases or injuries efficiently. And then, of course, this is actually how we view images in radiography. So now the history and the development of radiography, ladies and gentlemen. Radiography was discovered by William Conrad Roentgen in 1895. So the scientist that actually discovered radiography is William Conrad Roentgen. In 1895, he is the first scientist that was able to view inside of the body using X-ray. So the innovation actually revolutionized medical diagnostics by providing a non-invasive way to see inside the body. So that is why actually it is now the most commonly way of diagnosing diseases, because you can just use an X-ray to see exactly what is inside the body non-invasively. Since then, technological advancement have improved image quality and safety measure. Because since then, since scientists or healthcare professionals, since they were able to see how medical diagnostics is applied using radiography, and they were able to see inside the body using this radiographic method. So that is why a lot of technological advancement came up in order to improve the image quality and then the safety measures of the radiations. Because of course, these X-rays are using radiation to see inside of the body. And very importantly, you should understand that these radiations, they are very dangerous because they are they cause mutations, and of course they lead to so many diseases like cancer. So that is why safety measures is very important. So this is actually the William Conrad Roentgen. These are actually the first scientist that was able to discover radiography. So he's the father of X-ray. He is also the father of radiography. So then now the next thing is actually the principles of radiography. Starting with the X-ray. What is X-ray? X-rays are a form of electromagnetic radiation that can penetrate tissues to varying degrees. So that is what you need to understand. So it is actually a form of electromagnetic radiation that can penetrate tissues to varying degrees in order to see or in order to take the image of the body tissues. So very importantly, you should understand that denser tissues like bones, they absorb more X-rays and appear white on images. So you see, I think from these images, you can see that there are white images. So those white images, it means that they are denser tissues and they absorb more X-rays. That is why they appear white in images. And then, of course, for the less dense tissues such as muscles and organs, they appear darker due to lower absorption. So I think you can see that from this image, we have white images and we have dark image. So those white images, it means that they are denser tissues. And then those less dense tissues, they are the one that appears darker from the image. So these are actually the basic principles of radiography. The X-ray is a form of electromagnetic radiation that penetrates body tissues to varying degrees to observe or to take the image of inside the body. And for those tissues or organs that are denser, then their image will appear white. And those that are less dense, their image will appear darker. So then now we have different types of radiographic imaging. We have conventional radiography, which produce static 2D images for initial assessment. So in the conventional radiography, it is actually when it produces a 2D images, which is actually very important for initial assessment. And then, of course, we have digital radiography, which uses electronic sensors, offering quicker result and appear and better image enhancement. So in the case of actually digital radiography, it uses electronic sensor and it gives a quicker result, and at the same time, it also gives a better image enhancement. That is one of the importance of digital radiography. And then the next one is spatial techniques like fluoroscopy and contrast studies, which provide a dynamic and detailed views. So there are spatial techniques like the fluoroscopy and contrast studies, which provide a dynamic and detailed views. So it gives more details images. And of course, we have different image or different medical imaging techniques. We have X-ray, we have CT scan, we have MRI, we have ultrasound, and then we have PET scan. So these are actually the different types of medical imaging techniques, and we are going to take them one after the other. So now the next thing is safety and radiation protection. Minimizing patient exposure to ionizing radiation is a key concern in radiography, because if you too much expose patient to the ionizing radiation, then it might definitely lead to another disease problem. And therefore, protective measures, which include lead aprons, shields, and limiting exposure time, is also it's also another protective measures. Proper training ensures radiographers follow protocols to protect both patients and staff. So it is very important, as we can see from here. The best practices in radiation protection for healthcare workers include wear protective gear, one, minimize exposure time, maintain a safe distance from the radiation, follow the ALARA principle, and then a regular calibration of the equipment is very important. Radiation monitoring is also very important. Proper handling and disposal of radioactive materials, it is also very important. Training and education related to the radiography is also very important as a best practices in radiation protection for the healthcare. So future trend in radiography, advances include 3D imaging and integration with computer-aided diagnostic systems. Imaging technologies like cone beam CT improve diagnostic accuracy for various conditions, and then continued innovation will aims to make radiography safer, faster, and more precise for patient care. So, ladies and gentlemen, this is where I'm going to stop. Please don't forget to subscribe, follow, and join to my YouTube community for more videos.